loves, welcome back to my channel. I'm Natalie, and if this is your first time stopping by, thank you so much for doing so. I post medicine and lifestyle related videos, and if that's something that you'd like to see more of, then please do subscribe to my channel and join the family. And if this isn't your first time stopping by, thank you so much for coming back again. I truly appreciate you. So like I already mentioned, my name is Natalie. I am a doctor and I did study medicine in China. I graduated in 2020, and yeah, I've been working as a doctor ever since. So one of my earliest videos was titled "Should You Study Medicine in China?" and that video is currently doing well, and that was almost 4 years ago, and times have changed, things have changed, and one of my most frequently asked questions on my Instagram, in the comments on YouTube, everywhere I go, people ask me, is studying medicine in China really a good thing? Should I study my medicine in China? I thought today I would come and give you guys reasons not to study medicine in China. Just a disclaimer, this video is not a China bashing video. I will not be sitting here and telling you don't go to China because they're like this. No, this video is a video based on my experiences in China, the things that I experienced and the things that I've seen a lot of people struggle with, and the things that I think could be deal breakers for you. Unfortunately, a lot of these things are things you would realize when you're already in China and you've already been enrolled in the program. So without rambling on too much, these are my reasons why China might not be for you.
Now look at this. Now look at this. Now look at this.
So before we actually look at the reasons why you would consider not going to China, what are actually the reasons that a lot of people choose to make the sacrifice and make the decision to go anyway? And when I think about this, there's three main reasons. Firstly, and the largest group of people, those that go because it's cost effective or they have scholarships. I also went because it was going to be cost effective. Number two is the people that go because of the entry requirements being not as strict as other places, and then number three are just like a random bunch of people that want to go maybe because they want to learn a new language, culture, it's far, or whatever other reason. So with that said, let's now look at the reasons that you would consider not going to China. So number one, and this is a big one, is the language. Yes, you can go to China and study medicine in English like I did, as do most people, but you need to remember that in as much as your degree is going to be taught in English, most of your teachers aren't going to be able to articulate themselves as well as you in the English language. A lot of them are going to struggle with explaining themselves in English. So and they might know the medicine that they're teaching, but they know it well in Chinese and not in your English. Another place you need to consider the language is in your clinicals and in the hospital settings. In the hospitals, the main language of command and instruction is Chinese. The documents are going to be written in Chinese. The system is in Chinese. Medical reports, everything are going to be written in Chinese. Even drug names, antibiotic, paracetamol, whatever it is going to be written in Mandarin, and you're not going to know that if you don't know the language. Another thing also you need to consider is that all your patients are going to speak Mandarin. You might be part of the lucky bunch that might do their internship or their clerkship or their clinicals in a hospital where they speak English and they have English patients, but 99.99% actually of your patients are going to be Mandarin speakers who most probably don't know English and might actually be intimidated by the fact that you're a foreigner who does not speak Mandarin. And putting the studies aside, remember that you're going to be living within a community of people, most of whom are not going to speak English. Are you going to be able to go to the mall and buy groceries? Are you going to be able to go to the bank? Are you going to be able to go to the hospital yourself if you get sick? Are you going to be able to use the public transport? All these things are going to need you to have some kind of level of command of the Mandarin language. And so my conclusion for this point is, if you have no desire to learn Mandarin, if you're not necessarily good with languages, if you're not driven and motivated to learn a new language, then China probably isn't the place for you. Number two, the teaching style. So most of your teachers aren't going to be strict. Some might be a little strict, a little intimidating, but for the most part, Chinese teachers and professors are generally very laid back. I've attributed this to a couple of factors. Number one being Chinese people are generally regarded to be disciplined and self-driven and hardworking. So they don't need someone to push them to work hard. Whereas where we come from, in Africa, for example, we're used to being beaten into studying, right? Like literally in some cases. So you're not going to get any of that. Your teachers might not give you homework. They might not shout at you. No one really is going to force you to do anything. You're definitely going to need to put in a significant amount of extra work. You're going to have to be very self-motivated, very self-driven. And so you could very well find that your teacher comes and goes all throughout the semester, and then at the end of the day you failed, not because you weren't studying, but because your teacher actually marked your paper very strict, but they never told you in the beginning that they were going to do that, because they expected you to just go and put in the work for yourself. And so my conclusion for this point is, if you're not someone who is self-driven, self-motivated, and willing to put in a lot of extra work, then China might not be the place for you. Number 3, the Chinese education system. Specifically the Chinese medical education system. Now, I do go a lot deeper into this point in this video, which I talked about, should you study medicine in China? So I do recommend that you go and watch that video after this. But basically, the Chinese medical education system follows the British system in the sense that it is an MBBS program, that's Bachelor of Medicine and Bachelor of Surgery. It is 6 years, and those 6 years are divided into 5 years of straight school and 1 year of full-on clinical rotations. Now, the difference is that if you're studying medicine in Chinese, your program is going to be 5 years. If you're studying in English, it's going to be 6 years. Those 6 years are divided into first and second year, which are your basic sciences, third year, which is what I like to call the medical foundation, where you do pathology, pathophysiology, physiology, and those kind of courses. And then your fourth and fifth year are going to be your clinicals, where you start to do internal medicine, surgery, gynae, and pediatrics. And then finally, you have your final year, which is sixth year, which is an internship here. They call it an internship, but it's really just a clerkship, because an internship outside of China is something that is actually paid and post-grad, but the internship that you do in China in the last year is not a paid internship, and you definitely haven't graduated yet. You're going to have 2 semesters. The first one is going to run from September to January, and the second one is going to run from February to July. And so yeah, you're not going to get an MD degree, you're not going to get an MBCHB, you are going to get an MBBS degree. And my conclusion for this is, if your country does not allow you to practice with an MBBS degree, I know this could be a very rare cases, because most of the world generally accepts MBBS and MD and MBCHB. I'm not sure of the other forms, but those are the 3 most common ones I know. But if you happen to come from a country where they're very strict about this and they don't allow you to use an MBBS program, then do not consider China as your study destination. So one thing about studying medicine in China that I found to be a deal breaker is the way the curriculum is set up. It's set up in the sense that you're going to do anatomy, you're going to do physiology, you're going to do pathophysiology, you're going to do pediatrics 1, pediatrics 2, medicine 1, medicine 2, medicine 3, Chinese traditional medicine, pharmacology 1, pharmacology 2, and whatever course it is. And it's not really put together. It's kind of up to you to now start bridging those things, to start taking the anatomy you did in first semester or first year, to bring it back to the pathophysiology that you did in third year, and then to now sync it with the cardiovascular system that you're now studying in fifth year. And that for me was a challenge, because they kind of do it in the sense that once you've passed pharmacology, you're done with it, you don't see it again until fifth year again. Whereas in other countries, in Africa for example, when you do a system, you do the whole system. You do the anatomy, the physiology, the pathophysiology, the drugs used for that system. So is it beta blockers? Is it renal drugs? Is it antibiotics? What is it? Whereas in China, you kind of do anatomy, the whole anatomy, then you do the whole physiology, then you do the whole pathophysiology, then you do all pharmacology, and then you do all of pediatrics. And now when you're in pediatrics, you're really struggling because you can't remember things, and it's hard for you to now piece it together. And that is why a lot of Chinese students, a lot of Chinese trained students will struggle in their clinical courses because they don't know how to link the anatomy and the physiology and the pathophysiology and the pharmacology that they did with the actual medicine and the surgery and the gynae and the peds that they are learning. And this is why I say that you're going to need to do a lot of work on your own outside your curriculum, outside your classes. Another thing about the curriculum that might be a deal breaker for most of you is that, remember, you're studying medicine that is specifically pertaining to the region that you're studying medicine in. Let me give you an example. I'm African. I come from a place where malnutrition, HIV and AIDS, TB, those are the prevalent things we see in our society. In China, HIV is not a thing. It's obviously there's people that are HIV positive, but it's not a thing, it's not a disease that really greatly affects their population. I did HIV as a subtopic of a topic in like one semester. We literally did HIV in two classes, 45 minutes and 45 minutes, and that was it. Whereas here in Africa, there are books and books and books on HIV alone. So HIV was definitely one of those topics that I struggled to cope with in the hospital because I literally had no knowledge. I had never seen an HIV patient until I was already done with medicine in my final year when I came and did my internship in Botswana. But on the plus side, you do have that 1 year where you can, depending on the university that you're studying at, you can go back home and do your final year there, and that is one of the benefits, I guess, of studying medicine in China. So I know this is a reasons not to video, but I just want to put this in there so that you're not too discouraged. Now, some people complain that Chinese trained students don't have clinical knowledge, clinical skills, and I think this greatly depends on where you study, and this is something I'm going to touch on in the next point, so definitely keep watching. But for those of you that might not have time in the hospitals in your first to fifth year, you do definitely have that 1 year, that final year, and you should definitely maximize that. So this point for me is definitely one that I consider to be the most important, and that could have been a deal breaker for me. This is definitely a point that you want to consider deeply and sincerely and honestly before you decide to make the decision to go to China, because it could very well, this is the point that very well affects your career in the future. Point number 5, and this is the fact that there are thousands of universities in China. Now you're probably thinking, why would that be a deal breaker? But consider this: out of the thousands and literally thousands of universities in China, only a handful of those universities are actually properly and fully accredited and recognized by international boards. So you will find that someone might go to China and study medicine for 6 years, only to get back home and realize that they cannot practice, they cannot qualify in their country because the degree is not recognized by any institution worldwide. And this is a big deal, because a lot of people tend to just, maybe they've not done so well in high school, or they don't have funds to go where they want to go. So they're desperate to go to the next best place, which is China, and they just go to any university because of that desperation. And guys, I plead with you, before you go to China, make sure you either do your research properly and talk to the university representatives themselves, or make sure you use a reputable agent. I know there are so many agents out there and so many individuals that become agents themselves, but a lot of these are just businesses, and they don't necessarily care about your future. They care about making money. You really have to do your own part and make sure you research your universities properly. Like I said, a lot of the universities aren't recognized internationally, and some of them aren't even recognized by the Ministry of Education in China itself. Now, I did go into this and give details on how to know if the university is recognized, how to do your research. I went into this in detail in my other video, Should You Study Medicine in China? Definitely go and watch that if you want more information pertaining to this. So my conclusion for this point is that if you're not willing to do your research, if you can't find a reputable agent, then maybe pause for a while. Don't rush into going to study in China because you're in a hurry. Take your time, find a proper university, and then go. So some extra points I just want to throw there outside of these 5 main points that I've already raised. Number 1, if you want to work as a student, do not, I repeat, if you want to study and work in China, that is not going to happen, because China is very strict with their immigration laws. They're very strict with their visas and their permits, and if you get caught working illegally, it is over for you. You don't want to do that. You don't want to end up in that situation. And so this is definitely something you want to consider. If you were considering making money, a significant amount of money while being a student, you should definitely reconsider China and see if you can explore other options. Of course, some people are lucky to get a student visa that allows them to work as well. I'm not sure what exactly the name of the visa is called, but this is not very easy to attain, and so don't rely on that. Number two, if you're someone who likes freedom and just being able to make your own choices and decisions, then China might not necessarily be the best place for you, because again, China is very strict with their laws and their people. You will find university will just wake up one day and make rash decisions and they don't consult you. A lot of things like that happen, and people do get upset over that. It's happened to me, it's happened to a lot of my friends, a lot of people that I went to school with. If you don't like extremes of weather, if you don't like trying new things, trying new food, then again, China might not necessarily be the place for you. So we have reached the end of the video. These are the things that I thought are important for you to consider before you decide to make the decision to go to China. Medicine is a long program, and it's very important to decide where to do it and to decide properly and to decide on a good place to go and do this degree in. So I was fortunate enough that I did go to a properly accredited school. I did have my challenges. I did struggle with the language a little bit, but I was willing to learn it, and now I speak perfectly fine. I was also struggling with the food, with the environment, with settling into the community, but I did perfectly fine. I struggled with the curriculum a little bit until I decided I needed to put in more work, and then I eventually started this channel to help others. And now I'm a doctor, I'm qualified, and I have no issues. So these are the things that you definitely want to consider before you study medicine in China. But also remember that where there's a will, there's a way. So I really hope this video helped answer all the questions that I typically get. I really hope this video helps you make your decision. These are things that you typically won't know until you experience them yourself. So I really wanted to put this out there. If you still have any questions, if you still have anything that I might not have touched on that you want me to touch on, definitely leave a comment in the comment section and I will be sure to do that. I am considering doing a video on how studying medicine in China has affected my career as a doctor. If that's something you'd be interested in seeing, please leave a comment below and let me know, and I will be sure to do that. Otherwise, until then, do watch the other video, Should You Study Medicine in China? And subscribe to my channel if you haven't already. Turn on the post notifications so that you never miss a video from me, and I will see you in my next video. Bye.